Hi everyone, and welcome to the Rainbow Baby Week session about trying after loss. And we've got an amazing guest today. We've got Obstetrician Dr. Pavan. Thank you for joining us tonight, and I am going to pass over to you just to introduce yourself and tell us a bit about you and what you do.
Thank you. Thank you for having me. My name's Bevan, Dr. Bevan on Instagram. I'm an obstetrician gynecologist. I'm a senior registrar at the moment, coming towards the end of my training. And I run my social media page as a place to really promote health education related to women's health, making information accessible, easy to understand, and just helping women and people to understand their bodies and when to seek help when things aren't going right. Yeah, that's it.
Thank you. And I appreciate you obviously have a very busy life and schedule, so I'm so thankful that you have joined us to have this important discussion. So about trying again after loss, so I wanted to sort of speak to an obstetrician to find out from your point of view. Do people need to wait any particular length of time when trying after loss?
Yes, that's a really good question. And I guess that when we talk about loss, we're talking about loss of a pregnancy at any stage, really, aren't we? We can be
Yeah,
talking about early pregnancy loss, early baby loss in the first trimester or the second trimester or even the third trimester. And I
yeah,
guess depending upon where you fit into in those broad categories, that will really determine what investigations are done and whether it's then worth waiting for the results of those investigations to come back before you maybe want to start trying to get pregnant again.
yeah,
I mean, for first trimester loss in general, so in the first sort of 12 weeks or so, or the first 10 weeks or so, often if it's your first miscarriage, then we wouldn't routinely offer particular investigations. So I would say if you're in that sort of window, then it's really a case of understanding and knowing your own body and knowing what's right for you as an individual and as a couple and as a family unit and what's best for you. So I think it's really important to acknowledge that there's not only the physical aspect of going through a process of losing a baby, but there's also the mental load and the
yeah.
impact that that can have. So I guess it's sort of when you're both physically and emotionally ready to start trying again is really important.
Yeah,
After first trimester loss, you may want to wait for having, one period or one normal period, because that can just help to date any future pregnancies. So that can
yeah,
be quite helpful. But really, it's knowing what's best for you. And sometimes the advice that we give is to take a pregnancy test after your pregnancy's ended, after about 3 weeks or so, to make sure that you've got a negative pregnancy test, so that we know that that pregnancy is definitely over, that nothing further is needed. So sometimes we guide and say, 3 weeks, do another pregnancy test to make sure it's negative and contact the early pregnancy unit if it's positive.
yeah,
So I think it's sort of it can be quite individualized, but in general, after first trimester loss, whenever you feel ready, ultimately.
yeah. No, thank you. How about for later losses? Is it the same sort of advice?
So, losses after, like in your second trimester, you may be offered additional investigations. So you may have some blood tests done. You may be offered karyotyping, so sort of genetic testing of your pregnancy, of your baby. I think it's probably then, if you're having those tests done, it's probably then worth waiting for those results to come back.
Yeah,
And I'd say the same for sort of third trimester losses and
yeah,
late pregnancy losses. It's probably worth having those investigation results back so that you know whether any specific treatment needs to be commenced
yeah.
or not.
No, thank you very much. What are some things that people can do to support their body and health, and even sort of their mental health when they're trying again after a loss?
Yeah. So it's getting yourself, I guess, in the best mental and physical health that you can possibly get yourself in. And that's a combination of looking at diet, exercise, etc., looking at your body mass index, ensuring that's sort of within the limits that we recommend, because we know having a body mass index of less than 19 can increase your chance of miscarriage, and also having a high body mass index can also increase your chance of miscarriage. So it's trying to optimize that where you can. Exercise is really important, not only for your physical health, but for your mental health as well. Um, if you smoke, then we know that smoking is associated with miscarriage, so it's better to stop smoking. Alcohol intake, ideally, we recommend not having any alcohol when you're trying to get pregnant and when you're pregnant.
Yeah.
Limiting caffeine intake to less than 200 milligrams per day. So really thinking about how many cups of tea, coffee, Coke, chocolate, things like that. All these things contain caffeine. So looking at what your intake is and seeing if you can modify that. If you have any pre-existing health conditions such as diabetes, thyroid problems, epilepsy, anything like that, any chronic conditions, then it's always best to optimize them as well. I mean, we definitely know that poorly controlled diabetes can increase your risk of miscarriage. So it's always worth speaking to your doctor if you have any of those health conditions. Just doing a medications review and doing a general health review with your GP can just help you to just get good control over any sort of pre-existing conditions. So that's quite helpful. And then I think mentally, there's lots of patient support groups, such as yourselves. There's also Miscarriage Association, the ectopic pregnancy support groups, Tommy's. There's lots and lots that's out there, and we should really be promoting for people to actually use those resources, because they can be an excellent place where you can go and get that support from other people and other couples who have been or who are going through something similar to you.
Yeah.
We know that, especially in the context of recurrent miscarriage, so having, multiple miscarriages, we know that actually having that sort of support around you can really help with subsequent pregnancies and have more
Yeah.
positive outcomes.
Yeah. No, thank you. That's really helpful. In terms of professionals such as yourself, like what help and support can you offer to people who are trying to get pregnant and have a history of loss? Because I know you said after sort of one miscarriage you might not have much, but is there any sort of contact with people, anything that you can offer? And um, yeah,
Yeah, so I mean, investigation wise, we would normally look at investigations from second or usually third miscarriage onwards. So the guidelines, there's been a lot of work on the guidelines recently when we're talking about
yeah,
recurrent miscarriage and what should actually be regarded as recurrent miscarriage, because you almost go from a 0 to 100 approach. So with your first and second miscarriages, often people are offered nothing and just
yeah,
told that we're really sorry that this has happened. Chances are your next pregnancy will be absolutely fine. And then if you have three miscarriages, particularly if they were in a row, that was the previous guidance, then you suddenly have all these investigations, blood
yeah,
tests, scans, karyotyping for genetic material, and to see if there's any genetic anomaly, sorry. So you go from this 0 to 100 approach, and the recommendations from the Lancet are actually that we take more of a graded approach. So after first miscarriage, still sort of promoting access to support groups can be really, really beneficial. There's lots of online resources, and that's really very important. But also looking at the patient and the couple as a unique sort of couple, as a unique person, because actually you have to look at their specific circumstances and establish whether actually you do need to do any additional tests even after one miscarriage. So
yeah,
it's not just having this sort of blasé approach of, "Oh, I'm sorry it happened, next time should be okay." And it's really understanding and supporting people. So although you might not do lots of investigations after one, you should still offer support.
yeah,
After your second miscarriage, then the approach that's recommended is having a blood test done, looking at your full blood count, looking at your thyroid function to see if there's any room for optimizing that, and then referral to a specialist clinic. But some units are starting to take that approach, which is excellent, but I can't say that all units are doing that because the NHS just doesn't have the resources, and we need more resources, we need more funding, we need more to be able to provide the care that we actually want to provide.
Yeah. No, thank you. And yeah, I completely understand that it is everything is quite stretched at the moment. Um, you've mentioned some of the procedures, and obviously you've mentioned the blood tests. I think you've mentioned a procedure a couple of times. I just wondered if you could sort of talk about what people might expect if they were to go through something, an investigation.
So blood tests, as I said, thyroid function, we normally check for, we look for something called subclinical hypothyroidism as well. So that's when your thyroid function's low, but it's not classified as actually having hypothyroidism. But if it's on that sort of borderline, then sometimes we recommend starting treatment in those circumstances as well. Blood tests to look for any sort of blood clotting disorders, which could increase your chance of having a miscarriage as well. And if you meet certain criteria, you may be started on aspirin and blood thinning injections if you get pregnant or when you get pregnant. An ultrasound scan to look at the shape of the womb itself to see if there's any what we call anomalies in there's the normal shape of the uterus of the womb, but sometimes people can have septums which basically come down into the womb, so it changes the shape, or a bicornuate uterus where it sort of dips
That where
in
it's a
from the
heart
middle.
shape, like a
Yeah,
heart-shaped uterus.
exactly.
Yeah.
Yeah, exactly. So, having a look for things like that and then thinking about actually whether treatment would be beneficial or not. Sometimes we do these investigations and the guidance on what then to do and the data and the studies that we have to then inform what we should then do with the results are quite limited. So it's really sort of individualized discussion to have with the team who are looking after you.
Thank you very much. Going to your job, what do you feel is the hardest part of this job for you?
Um, I think the hardest part is when you're breaking bad news and you don't have a reason for that happening,
Yeah.
because telling someone that everything was fine and now it isn't is really, really difficult to say, but it's really difficult to for couples to actually understand and take on board because there is no explanation. It's well, what do you do with that? We were
Yeah.
just unfortunate. Okay, so will it happen again? What's the likelihood? And you say it's unlikely to happen again, and then if they come back and it's their second time, it's really hard not to have answers, and I think that's the hardest thing.
Yeah. And what is the best part of this job for you?
I mean, the best part is definitely when you see the success stories. It's definitely when you see patients coming back and they are pregnant and things are going well. But saying that, although that's really lovely to see, they often need a lot of support because it can, these are women and couples that I can meet much later on in their pregnancies, not necessarily at the start of their pregnancy, and they can feel very anxious, very nervous. It can really affect their whole pregnancy, and they can feel less positive about their pregnancy and,
Yeah.
worry constantly and continually about everything, and that can be very, very overwhelming. And then when you're there at the latter stages of the pregnancy, you're looking after women in labor who have gone through this horrible ordeal to even get to where they are. When you then need to consider doing emergency interventions, it can be really, really difficult to navigate that.
Yeah.
And so it's really a case of offering lots and lots of support. And I think that if you know you've been through a really difficult time to get to that point where you're happy that you're pregnant and things are going well, it's always worth just discussing that with your midwife early on, because they can then offer you additional appointments if required, refer you to a consultant-led clinic if required, refer you to a consultant midwife, so that they can really look into any anxieties that you might have, so that when we're then providing care for you at the latter stages of your pregnancy and in labour, that it's much easier for you and for the team looking after you to provide the best care possible for you.
Yeah. No, thank you. That's all really Amazing advice and information. Thank you so much for joining us and for holding this session with me. Despite I know everything is busy at the moment, but yeah, thank you so much for being here and being part of this Rainbow Baby Week campaign.
No, you're more than welcome. Thank you for having me. And I hope that's given some insight and helped at least one person out there. That would be brilliant.